We'll be going to tackle the autism spectrum disorder or ASD. What is autism spectrum disorder, by the way? According to the psychiatrist Daniel Moreno de Luca, he defined ASD as a complex developmental condition involving persistent challenges with social communication, restricted interest, and repetitive behavior. Additionally, according to the National Institute of Mental Health, ASD is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Therefore, people with ASD have differences in their brain function that can impact their behavior and social interactions. And did you know that the term spectrum in autism spectrum disorder is actually refers to the wide range of symptoms and severity? Yes, it is, which means that it is not just a singular condition, but this autism could affect people in different ways and in varying degrees. Now, what are the things that we can observe with a person that diagnosed with ASD? Well, according to the Diagnostic and Statistical Manual of Mental Disorders or DSM-5, a person or people with ASD often have the following. First, difficulty with communication and interaction with other people. It means that communication and understanding others' thoughts and emotions might be difficult for someone with autism. This makes it hard for them to express themselves either with words or through gestures, facial expressions, and touch. Second, restricted interest and repetitive behaviors. And actually, these are the things that we can observe with to the person no, with ASD. Repeating certain behaviors or having unusual behaviors such as repeating words or phrases, and this kind of behavior is what we call echolalia. And other example of this is like having a lasting intense interest in specific topics such as numbers, details, or facts, showing overly focused interest such as with moving objects or with parts of objects. Another one is becoming upset by slight changes in the routine and having difficulty with transitions, and also being more sensitive or less sensitive than other people to sensory input such as light, sound, clothing, or temperature. Third, symptoms that affect their ability to function in school, work, and other areas of life. It means that people with autism can come with learning problems, including developing skills at an uneven rate. For example, someone with autism could have trouble communicating but be unusually good at art, music, math, or things that involve memory. Because of this, they might do especially well on tests of analysis or problem solving. According to the National Institute of Mental Health, researchers don't know the primary causes of ASD, but studies suggest that a person's genes can act together with aspects of their environment to affect development in ways that lead to ASD. And there are some factors that are associated with an increased likelihood of developing ASD. And it includes having a sibling with ASD, having older parents, having certain genetic conditions such as Down syndrome or Fragile Time syndrome. Also, having a very low birth weight. But actually, not everyone who has these risk factors develops ASD. And now, let's move on to the different types of autism by Christina Stewart. So, first type of autism is the classic autism or autistic disorder. And actually, people with this type of disorder may struggle with understanding social cues, maintaining eye contact, and engaging in reciprocal conversation. Second one is the Asperger syndrome. Person with this type of disorder may be struggled with social interactions and understanding social norms, leading to challenges in forming friendship and maintaining relationships. Third one is the pervasive developmental disorder or not others specific, no, or the PDD, diagnosed. It was often used for individuals with milder symptoms or late onset autism. With the updates in diagnostic criteria, PDD-NOS is now subsumed under the broader category of autism spectrum disorder. Part 1 is the childhood disintegrative disorder or CDD. So, actually, it is a rare condition where typically developing children suddenly lose previously acquired language, social, and motor skills. Actually, it shares similarities with autism, but it is distinguished by rapid and significant loss of skills. The fifth one is the Rett syndrome. So, individuals with Rett syndrome often experience repetitive hand movements, breathing irregularities, and cognitive impairment. And the sixth one is the high functioning autism. Many individuals with high functioning autism may not receive a diagnosis until later in life due to their ability to mask their difficulties in certain situations. Now, what are the ways or what are the things that we can do in order to help these children that has been diagnosed with ASD? First, applied behavioral analysis. So it involves systematic study of the child's functional challenges, which is used to create a structural behavioral plan for improving their adaptive skills and decreasing inappropriate behavior. Second one is social skills training. It is done in group or individual settings. And this intervention helps children with autism improve their ability to navigate social situations. The third one is speech and language therapy. It can improve the child's speech patterns and understanding of language. Occupational therapy can address adaptive skills deficits with activities of daily living as well as problems with handwriting. The fourth one is parent management training. Of course, it is really important because parents learn effective ways of responding to problematic behavior and encouraging appropriate behavior in their child. Parent support groups help parents cope with the stressors of raising a child with autism. The fifth one is special education services. These are provided by schools under an individual education plan and can include a range of services and accommodations for social communication deficits, restricted interest, and repetitive behaviors. This can include special classes for very young children to address language, social skills, and other needs. The sixth one is treating co-occurring conditions. Children with autism are more likely to experience insomnia, attention deficit, hyperactivity disorder or ADHD, intellectual disability, anxiety, and depression than peers without autism. This condition will also need to be addressed. The impact of these conditions can be reduced with the proper services, which can include any of the above, no, or katong na-mention na, as well as psychotherapy and or medication. Treating these conditions typically involves coordination with pediatricians or primary care clinicians. And last one, medication. A child psychiatrist can evaluate for other mental health conditions and prescribe medications if appropriate. So for an example, autism-related irritability that does not respond to behavioral interventions can be reduced by medications such as aripiprazole and risperidone. The two medications approved by the Food and Drug Administration for irritability associated with autism, prescribed judiciously by knowledgeable clinicians in collaboration with the child's parent. Understanding the diverse types of autism is crucial for providing appropriate support and interventions for individuals on the spectrum. While each type may present unique challenges and strengths, it is really essential to recognize the inherent value and potential of every individual with autism.
Going to report the speech or language impairment. Discuss the symptoms, types, causes, and risk factors impact on treatment. First is speech or language impairment. So what is this? It is a communication disorder that affects an individual's ability to speak, understand, or to express the language effectively. These impairments can range from mild to severe and may impact the academic performance, social interactions, and the overall quality of life. According to the Individuals with Disabilities Education Act or IDEA, speech or language impairment is recognized as a disability that requires special education services according to U.S. Department of Education 2020.
Symptoms and types are just the same.
Symptoms of speech or language impairment. The symptoms may vary depending on the type and severity of impairment. First is fluency disorder. It is a person who repeats a sound, word, or phrase, and stuttering may be the most serious disfluency, and it may be caused by the following example. First is genetic abnormalities. For example, Mark is a 10-year-old boy, and he has been stuttering since he started speaking. His father and grandfather also had stuttering issues. So, since stuttering can run in families, Mark's condition may be linked to genetics. Second is emotional stress. Anna is a 6-year-old girl began stuttering after her parents went through a divorce. She was fluent before, but after experiencing emotional distress, she started repeating sounds and hesitating while speaking. Third is trauma to the brain or infection. For example, James is a man and he had a car accident that leads him to have a brain injury. Articulation disorder. This is a difficulty in pronouncing words correctly, such as substituting or omitting sounds. Here are the examples of articulation disorders where a child struggles with pronouncing words correctly. First is substituting or omitting sounds. Example, a 4-year-old child might say cool instead of school, leaving out the S sound at the beginning. Second is trouble pronouncing certain sounds. A 5-year-old child might have difficulty pronouncing the R sound and say wabbit instead of rabbit. Distorted or changed sounds. A 7-year-old child may simply distort the S sound by pronouncing it with a whistle says S instead of the clear S sound in a word like sun or sucks. Fluency disorder is the disruption in the flow of speech, including stuttering, such as stuttering where speech is interrupted. Here are the examples of fluency disorders, such as stuttering. It is just like the repetition of sounds, words, or parts of words. A 6-year-old child might say, I want my doll, repeating the I sound when expressing a simple desire. Second is interjecting extra sounds or words. A 7-year-old might say, we went to the store, inserting a hesitation sound while trying to recall the word store. Third is making words longer. An 8-year-old child might say, I am Booby Jones, stretching the B sound, which is common in children with fluency disorder. Fourth is pausing during a sentence or words, often with the lips together. A 9-year-old might pause for a few seconds in the middle of a sentence, holding their lips together, saying, I want to go home. Tension of the voice or sounds. A 10-year-old girl might sound tense with speaking, especially during moments of stuttering, where the words come out with a force tight alone. 6 is frustration to attempt to communicate. For example, a 7-year-old boy might express frustration saying, I can't say it. He struggles with stuttering during a conversation. 7 is head jerking while talking. A 5-year-old may jerk their head while speaking, especially during moments of stuttering as part of their physical reaction to the speech disruption. 8 is eye blinking while talking. A 6-year-old child might blink their eyes rapidly while trying to get out a word, especially during moments of tension in their speech. 9 is embarrassment with speech. For example, an 8-year-old might feel embarrassed about their speech and avoid speaking in front of others, especially during moments of stuttering, saying, I don't want to talk now. Let us go with phonological disorder. It is a type of speech sound disorder where a child has difficulty understanding and using the rules of speech sounds or phonology to form words. This means that a child may have trouble with certain patterns of sounds such as omitting, substituting, or changing sounds in words. Here are the examples of phonological disorders where a child has difficulty using speech sounds correctly to form words. First is not using some or all of the speech sounds to form words as expected for their age. Example, a 4-year-old child might say k instead of cat, leaving out the final sound in the word, which is a common feature of phonological disorder. Second is leaving out or changing the last or first sound of words. Example, a 5-year-old child may say tar instead of star, omitting or changing the consonant sounds at the beginning or end of the word. Sounds in other words. For example, a 6-year-old child may say boo instead of book and pee beside of pig. Examples of how different factors can contribute to speech and language impairments. First is neurological conditions. It is on our brain. It could have those stroke, cerebral palsy. Example, Emma is a 5-year-old girl with cerebral palsy and has a difficulty controlling her facial muscles, which affects her ability to articulate words correctly. This neurological condition makes it challenging for her to form certain sounds and speak fluently. Second is hearing loss. Example, year old boy wherein he has an infection in his ears. That's why he struggles to pronounce words because he cannot hear clearly. Third is genetic factors. Example, Lily is a 4-year-old girl and was diagnosed with childhood apraxia or speech, a motor speech disorder that runs in her family. Her father also had a difficulties with speech development, and her grandmother had a history of speech delays, suggesting a genetic connection. Fourth is environmental factors. That example is Noah is a 6-year-old child raised in an environment with limited verbal interaction and no exposure to books or language that shows signs of language impairment. He has a difficulty constructing sentences and understanding the complex speech because he did not have sufficient language input during his early years. So now let us go with the approaches to support speech or language impairment. First is speech therapy. For example, Olivia is a 6-year-old with articulation issues, attends weekly speech therapy sessions where her therapist helps her practice the R sound, leading her position to her tongue correctly. Second is assistive technology. Example, Liam is a 7-year-old boy with severe apraxia of speech. He uses a speech generating device that helps him communicate more easily. The device reads out words or phrases when Liam presses buttons, allowing him to express his needs more clearly. Third is classroom accommodations. Example, in his kindergarten class, Ben, a 5-year-old with speech delay, benefits from a visual aids such as picture cards and a simplified instruction method where the teacher breaks down tasks into smaller, manageable steps. This helps Ben to follow along more easily during lessons. Treatment for speech disorders have milder forms of speech disorders that might improve over time without treatment. For example, a preschool child who has difficulty pronouncing certain words might grow out in a continue developing their speech skills. More severe symptoms might require speech therapy. For example, a child with stuttering may work with a therapist on fluency techniques to reduce disruptions in their speech. Example, Max is a 9-year-old boy with a speech disorder, works with a therapist on slowing his speech rate and practicing smoother transitions between words to address his stuttering issue. Voice disorders are caused by problems when air passes from the lungs through the vocal cords and then through the throat, nose, mouth, and lips. A voice disorder may be due to. Here are the following examples of voice disorders that is caused by different factors. First is acid from the stomach moving upward, or the GERD. Example, Sarah is a 40-year-old teacher, often experiences hoarseness in her voice, especially in the morning. Her doctor diagnosed her with gastroesophageal reflux disease, or the GERD, where stomach acid irritates her vocal cords, making her voice sound through and strained. Second is cancer of the throat. Example, Jan is a 55-year-old former smoker, started experiencing a persistent hoarse voice and difficulty swallowing. After a medical exam, doctors found he had a throat cancer, which affected his vocal cords and changed his voice quality. Treatment. Children may outgrow milder forms of speech disorders. The type of treatment will depend on the severity of the speech disorder and its cause. Speech therapy may help with more severe symptoms or any speech problems that do not improve. In therapy, the therapist may teach your child how to use their tongue and to create certain sounds. And here are the parental support. First is to avoid excessive concern. Example, Sarah is a parent of a child with mild stuttering, avoids expressing anxiety about her child's speech issues, creating a relaxed atmosphere for her child to speak without feeling pressured. Second is to avoid stressful social situations. Example, James is a 7-year-old with a severe articulation disorder. It is not asked to speak in front of a large groups to avoid additional pressure or embarrassment, which helps him feel more comfortable. Third is to listen patiently, make an eye contact and avoid interrupting. Example, while Jack is speaking, his mother listens attentively, making eye contact and refraining from finishing his sentences, giving him time to communicate at his own pace. Fourth is to set aside time for talking. Example, every evening, Tim's parents set aside 10 minutes of quiet time to encourage their child to talk about his day, providing a safe, non-judgmental environment for him to practice and improve his speech skills. And here we are with the impact on learning and social development. Students with speech or language impairments may experience difficulties in academic subjects, especially reading and writing. Additionally, social interactions may be affected, leading to a low self-esteem and frustration, according to Paul and Norbury 2020. Early intervention and individualized support strategies are crucial in helping children develop effective communication skills.
So, hi everyone! Today we're going to talk about hearing impairment or hearing loss. It is a common condition that affects millions of people and it is important to understand what it is, how it happens and what we can do about it. So, what is hearing impairment? So, what exactly is a hearing impairment? It's the partial or complete inability to hear the sounds. It's not just about how loud something is, but also also about how well our brains can process those sounds. Think about it. We hear sounds, but our brains are the ones that make sense of those sounds. So, hearing impairment has three main characteristics. Hearing impairment can range in severity. Here are different levels. So, mild hearing loss is like missing a whisper but still being able to follow a conversation. With moderate hearing impairment, you might have trouble hearing normal conversation or especially in noisy places. So, people with severe hearing loss may need to use lip reading or sign language to understand what's being said. With profound hearing loss or hearing impairment, someone hears very little or nothing at all, even with hearing aids. Sorry. Types of hearing impairment: visual aid or uh, types of hearing impairment. Now, let's talk about the different types of hearing impairment or hearing a visual representation of them. Conductive hearing impairment happens when sound waves or trouble traveling through outer or middle ear. It is like a blockage in the ear or in the ear canal, preventing sound from reaching the inner ear. So sensorineural hearing or is in HL is caused by damage to the inner ear or the nerve that carries sound to the brain. This is often permanent. So, mixed hearing impairment is a combination of both conductive and sensorial hearing loss or hearing impairment. And central hearing impairment is the rarest type. It happens when there are problems in the brain that prevent it from processing sounds correctly. So, functional hearing impairment is not a true or hearing loss. The ears work normally, but the person doesn't respond to the sounds. It is often linked to mental health or condition. Now, conjunctive hearing loss, or let's look closer and conductive hearing loss. The common causes are things like earwax buildup or infections like air infection or fluid in the middle ear or damage to the eardrum, it can often be treated with medications, surgery, or by removing the blockage in the ear canal. So now, let's talk about sensorineural hearing loss or SNHL. This is caused by damage to the inner ear or the nerve that carries sound to the brain. Loud noises, aging, head injuries, and some medical condition can cause in SNHL. And unfortunately, this type of hearing impairment is often permanent. People with in SNHL can benefit from hearing aids or cochlear implants, which help amplify sounds and send them directly to the brain. So, how are different types of hearing impairment treated? So, conductive hearing impairment is treatable with medication or surgery or earwax removal. So, sensorineural hearing impairment can be managed with hearing aids or cochlear implants, which amplify sounds and send them directly to the brain. Now, treatment for hearing impairment depends on the specific problems in the ear. Central hearing impairment is more difficult to treat, but sometimes therapies can help. Treating functional hearing loss focuses on addressing the underlying mental health issues. So preventing hearing impairment, noise is the enemy. The most important thing we can do to protect our hearing is to avoid loud noises. Loud noises are the biggest cause of preventable hearing loss. Here are some tips for protecting your ears or our ears. Use earplugs or earmuffs when exposed to loud noises like concerts, construction sites, or loud machinery. Now, or point to lower the volume or turn down the volume on your music or TV, especially when using headphones. Now, don't stick anything your ear like cotton swab. This could damage the eardrum. Yeah, eardrum. And don't smoke. It can affect hearing, exercise, and manage chronic health or conditions to protect your hearing.
Deafness. Deafness is a complex condition with both medical and cultural implications. It refers to the complete or partial loss of hearing, implicating an individual's ability to perceive sound and understand spoken language. While the medical definition focuses on the degree of hearing loss, the culture context emphasizes the unique experiences and identify of the deaf community who primarily communicate through sign language. In a medical setting, deafness is defined as a hearing loss that prevents a person from understanding spoken language, even with implications. The severity of hearing loss can range from mild to profound, with total deafness signifying the inability to hear any sound regardless of implications. So now let's talk about the four primary types of hearing loss. So first, we have a conductive hearing loss. Second, sensory neural hearing loss. Third one is mixed hearing loss. And the fourth one is auditory neuropathy spectrum disorder. First one is conductive hearing loss. It is occurs when sound waves are blocked from reaching the inner ear due to problems in the outer or middle ear. Second one is sensory neural hearing loss. It is a result from damage to the inner ear or the auditory nerve, affecting the transmission of sound signals to the brain. And the third one is mixed hearing loss. It is combines elements of both conductive and sensory neural hearing loss. The fourth one is auditory neuropathy spectrum disorder. It is involves damage to the auditory nerve, leading to difficulty processing sounds despite normal hearing in the inner ear. And now let's proceed to the deafness culture context. Deafness culture emphasizes a vibrant community of individuals who share a common language, values, and traditions. Let's talk about the seven causes of deafness. So first, we have a genetics. Second, prenatal factors. And the third one is parental complications. Fourth one is childhood infections. Fifth one is exposure to loud noise. Six is autotoxic medications. And lastly is aging. In genetics, hereditary hearing loss can be passed down through families. Prenatal factors, infections like rubella and cytomegalovirus during pregnancy can lead to hearing loss in newborns. And the third one is prenatal complications. Birth asphyxia, known as lack of oxygen, and hyperbilirubinemia, known as severe jaundice, can damage the auditory system. Childhood infections, chronic ear infections, meningitis, and other infections can affect hearing development. And the fifth one is exposure to loud noise. Prolonged exposure to loud sounds, particularly in occupational setting, can cause noise-induced hearing loss. And the sixth one is ototoxic medications. It is a certain medication can damage the inner ear, leading to hearing loss. The last one is aging. Age-related hearing loss, also known as presbycusis, is a common condition affecting older adults. There are impacts of deafness. First is communication difficulties. It is deafness individuals may face challenges in understanding spoken language and communicating with hearing individuals. So second one is social isolation. Deafness can lead to social isolation and a sense of exclusion from mainstream society. Third one is educational disparities. Children with hearing loss may experience difficulties in access, educational, and achieving their full potential. Last one is employment barriers. Deaf individual may face discrimination in employment and have limited access to job opportunities. Now let's talk about prevention and management. Many causes of hearing loss are preventable through public health measures and clinical interventions. First, we have immunization. Vaccinations against preventable infections like rubella and meningitis can reduce the risk of hearing loss. And second one is early identification and intervention. Screening for hearing loss in newborn and children can help detect and address hearing problems early. And the third one, hearing conservation programs, implementing workplace safety measures and promoting self-listening practices can prevent noise-induced hearing loss. And the fifth one is rehabilitation services. Providing hearing aids, cochlear implements, and other assistive devices can help individuals with hearing loss communicate effectively. And the last one is sign language education, promoting the use of sign language and providing education. Sign language can enhance communication and inclusive deaf individuals.
Let's move to intellectual disabilities. So what is intellectual disabilities? So when we say intellectual disabilities, it is also called intellectual developmental or disorder. Is a condition where limitation in mental disabilities affect intelligence, learning, and daily life skills. Now, it is typically appears in childhood and can vary in severity from mild to intellectual disabilities, or it is also included IQ misconception. It's not just about IQ. So while IQ tests are used, they don't provide the full pictures. And some people may have a higher IQ but still struggle with daily life skills, while others may have a lower IQ but still manage to live independently or have strengths in other areas. So now let's move to symptoms. So there are symptoms and intellectual disabilities. No, so this is the symptoms also included delayed learning or trouble with reasoning, problem solving, judgment, focus, and critical thinking, and adaptive behaviors is also included. The difficulties with self-care, social skills, understanding time and money, and managing daily life activities. So some individuals help with basic tasks like dressing, bathing, or maintaining personal hygiene. So now let's move to the causes of intellectual disabilities. So pervert causes or genetic mutations or Down syndromes, infections, teratogens, substances like alcohol or tobacco. And this is also the medical conditions during pregnancy. So birth-related causes or lack of oxygens, premature birth, and brain injuries during birth. Early childhood causes, injuries, early childhood causes, injuries, toxic exposures, infections, and medical conditions like epilepsy. And the last one is diagnosis and severity. Intellectual disability is diagnosed based on IQ, adaptive behavior, and age of onset. The severity can vary vary or live independently with minimal support, or moderate to severe required more assistance with daily life activities throughout life.
Specific learning disorder. Specific learning disorder or SLD combine or learning disorder which includes reading, mathematics, and written expression into one overarching diagnosis. According to American Psychiatric Association, an estimated 5 to 15% of school-age children struggle with a learning disability. An estimated of 80% of those with learning disorders have an impairment in reading, and particularly one is dyslexia. To be diagnosed with a specific learning disorder or SLD, a person must meet 4 criteria according to American Psychiatric Association. The first one is have a difficulties in at least one of the following areas for at least 6 months despite targeted help. The first areas is difficulty in readings, difficulty in understanding the meaning of what is read, difficulty with spelling and difficulty in written expression, difficulty in understanding number concept, number facts or calculation, difficulty with mathematical reasoning. And the second criteria is have academic skills that are substantially below what is expected for the child age and cause problems in schoolwork or everyday activities. This criterion requires academic skill challenges to be based on standardized achievement and comprehensive clinical assessment. And the third criteria is the difficulties start during school age even if some people don't experience significant problems until adulthood. And the fourth criteria is learning difficulties are not due to other conditions such as intellectual disability, vision, or having problems, neurological condition. Adverse conditions such as economic or environmental disadvantage, lack of instruction, or difficulties speaking or understanding the language. Types of specific learning disorders: dyslexia, dysgraphia, and dyscalculia, according to American Psychiatric Association. The first one is dyslexia. With impairment in reading, I is added to the SLD diagnosis when a person demonstrates significant impairment in one or more of the reading skills, including word reading accuracy, reading rate or fluency, and reading comprehension. The second one is dysgraphia. An impairment in writing skills is assigned to the specifier with impairment in written expression and refers to those children with impaired spelling and problems with writing that can conclude difficulties with accuracy, grammar, and punctuation accuracy and clarity or organization of written expression. And the third one is dyscalculia with impairment in mathematics for individuals who demonstrate significantly below average skills in a number science of memorization of arithmetic facts, accurate and or fluent calculation, and accurate math reasoning. Treatment. Having a learning disorder does not mean a person is limited in their choice of career or the opportunities for success. Early intervention is key for people with an SLD. A problem are identified, early intervention can be more effective and children can avoid going to extended problems with schoolwork and possible challenges with self-esteem.
Orthopedic impairment. Orthopedic impairment is a physical disability such as paralysis, poor muscle control, difficulty with speech production, or the loss of limb, which limits one's ability to perform daily living activities. Orthopedic impairments can negatively impact a child's ability to achieve academic success. A child's education can be affected at varying degrees, depending on the type and severity of the impairment. Since students with orthopedic impairment typically have the same cognitive abilities as their peers, they should be included in mainstream classes as much as possible. The characteristics of orthopedic impairment largely depend on the specific disease, its severity, and factors that are specific to each case, such as access to therapy, equipment, and mobility aids. It is also important to consider whether the orthopedic impairment is affecting a child or its adult. as each has different needs connected to different areas of their lives that are affected by the orthopedic impairment. So we have three types of orthopedic impairments. First, we have the neuromotor impairments. This type of impairment can be described as damage to or abnormality of the brain, nervous system, or spinal cord, which is responsible for sending neural impulses to muscles of the body, facilitating voluntary movement in many cases. These types of impairments are congenital, but they can also be acquired at birth. Second is the musculoskeletal disorders. This category of orthopedic impairment encompasses several conditions which can all cause wide-ranging degrees of limitations and restrictions of movement. Musculoskeletal disorders can affect the joints, bones, muscles, and tendons. These affections can be congenital or acquired later in life, and examples include diseases such as osteoarthritis, rheumatoid arthritis, osteoporosis, and limb deficiency. And lastly, the degenerative diseases. Degenerative diseases are those that worsen over time and tend to damage the structure of the affected tissues progressively. These diseases have a profound effect on motor function and movement and are usually described in terms of the structure of the musculoskeletal system that are affecting. The orthopedic impairment causes. When considering the causes of orthopedic impairment, it is important to bear in mind that orthopedic impairments can either be congenital, can be acquired at birth, or later in life by other means. First, we have impairments caused by congenital anomaly. Can also be caused by exposure to chemicals, medicines, and other toxic substances during pregnancy, as well as infections or uncontrolled medical conditions during pregnancy. Second, the impairment caused by disease. Some orthopedic impairment can be caused by diseases that are acquired after birth. Diseases such as polio can cause significant impairment and motor deficits, as it usually results in various degrees of muscle paralysis. The third one is the impairments with environmental causes. Environmental causes range from injury to amputation and birth trauma. Birth trauma can occur during labor or delivery and can result in oxygen deprivation to the brain, resulting in significant brain damage and orthopedic impairment.
Major depressive disorder. Depressive disorder is also known as depression. It is a common mental disorder which involves a depressed mood or loss of pleasure or interest in activities for a long period of time. The term anxiety disorder covers several difficulties sharing irrational fear as a core site. This includes panic disorder, post-traumatic disorder or PTSD, social anxiety disorder also called as phobia, and specific phobias. PTSD is a thought to occur only in veterans. Military service is only one example of a source of trauma. Trauma can originate from any sources, including car accidents, abuse, natural disasters, or terrorist attacks. It also occurs in the instance of medical abuse and trauma.
Go.
A phobia is an anxiety disorder defined by an irrational, unrealistic, persistent, and exists of fear of an object or situation. There are types of phobia. First one is acrophobia. It is an intense fear of heights. If a person has acrophobia, being high up or thinking about the heights may cause them to have a panic attack. Second one, arachnophobia. It is an extreme fear of spiders and other arachnids. It is caused symptoms such as sweating,
dizziness, and nausea. Treatments may include therapy such as exposure therapy. Arachnophobia. It is an extreme fear of spiders and other arachnids. It is caused symptoms such as sweating, dizziness, and nausea. Treatments may include therapy such as exposure therapy. Aerophobia. It is a type of anxiety disorder. A person
Go.
Aerophobia, a type of anxiety disorder. A person with a
Go.
Aerophobia is a type of anxiety disorder which a person with agoraphobia is afraid to leave the environment they know or consider to be safe. Pause.
Go.
Claustrophobia is the fear of confined spaces. It is triggered by many situations or stimuli, including elevators, especially with crowded to capacity, windowless rooms, and hotel rooms that are closed, and of course the sealed windows. It is typically classified as an anxiety disorder which often results in panic attacks. The next one is the glossophobia or speech anxiety. It is a fear of public speaking. The causes of glossophobia are uncertain, but explanations include the community and the illusion of transparency. The next one is the cynophobia. It is a fear of dogs and canaries in general. Cynophobia is classified as a specific phobia under the subtype of specific animal phobia. The next one is the mesophobia or mysophobia, also known as an erminophobia.
Go.
Mesophobia, also known as erminophobia, herbophobia, germophobia, bacilliophobia, and bacteriophobia. It is a pathological fear of contamination and germs.
Go.
Fear of needles. It is known in medical literature as needle phobia, the extreme fear of medical procedures knowing injections or hypodermic needles. The next one is the aquaphobia, or from the Latin words aqua means water. It refers to the irrational fear of water. And the next one is the specific phobia. It is an anxiety disorder characterized by any extreme reasonable and irrational fear associated with a specific object, situations, or concept which possess little or no actual danger. Astrophobia, also known as astrophobia,
Go.
Astrophobia. Astrophobia. It is a type of astrophobia. It is known as astrophobia, also known as astrophobia, brontophobia, cyranophobia, and tonitophobia. It is an abnormal fear of thunder and lightning, or an unwanted fear of scattered or isolated thunderstorms. The next one is the ovidophobia. It refers to the fear of snakes, in which it is sometimes called by the more general term herpetophobia, or fear of reptiles. Emetophobia. It is a phobia that causes overwhelming intense anxiety pertaining to vomit. And anaxophobia is a driving phobia, driving anxiety on Anaxophobia. It refers to driving phobia, driving anxiety, vihophobia, anaxophobia, or driving-related fear, or DERF. It is an intense, persistent fear of participating in car traffic or in other vehicular transport that affects a person's lifestyle, including aspects such as inability to participate in certain jobs due to pathological avoidance of driving. The next one is the anthophobia. People who have anthophobia have an extreme fear of flowers. Anthos in a Greek word which means flowers, and it all refers to the fear of flowers. The next one is anthropophobia. It is referred to the fear of people, which anthrophobia may avoid crowds, fear of eye contact, or worry that they are being judged. And the next one is bacteriophobia, mesophobia, also known as verminophobia, germophobia, gymophobia, bacteriophobia. It is a mesophobia, also known as verminophobia, germophobia, bacilliophobia, and bacteriophobia. It is a pathological fear of contamination and germs. And the next one is the dentophobia. Dentophobia is a normal emotional reaction to one or more specific reaction threatening stimuli in the dental situation. However, dental anxiety is indicative of a state of apprehension that something dreadful going to happen in relation to the dental treatment, and it is usually coupled with a sense of losing control. The next one is nosocomophobia. Nosocomophobia. It is a defined excessive fear of hospitals. The next one is snakes. Ophidiophobia. It is an extreme overwhelming fear of snakes. It's more intense than the common generalized fear of snakes. And the next one is zoophobia. It is an extreme fear of animals. Many people would have zoophobia, fear one specific type of animal. And the last phobia is aclophobia. It is a type of fear of darkness, a condition that is often misunderstood and can have a significant impact on a person's life. Those who suffer from aclophobia experience an overwhelming sense of fear when exposed to darkness to low light conditions. Those are the types of phobia. And the next one will not belong to the phobia. It belongs to the emotional, it refers to the emotional disturbance. Cyclothymia. It refers to as an affective personality disorder and cyclothymic personality disorder. It is a mental and behavioral disorder that involves numerous periods of symptoms or depressions and periods of symptoms of elevated mood. And the second one is the destructive mood regulation or DMDD. It is a mental disorder in children and adolescents characterized by a persistently irritable or angry mood and frequently temper outbursts that are disproportionate to the situation and significantly more severe than the typical reaction of the same age peers. And the next one is the intermittent explosive disorder or DED or episodic dyscontrol syndrome or EDS. Is a mental and behavioral disorder characterized by explosive outbursts of anger or violence, often to the point of rage, that are disproportionate to the situation at hand. And example of this is impulsive shouting, screaming, or excessive demanding triggered. Oppositional defiant disorder or ODD is listed in the DSM-5 under the disruptive impulse control and conduct disorders and defines as pattern of angry or irritable mood, argumentative defiant behavior, or vindictiveness. This behavior is usually targeted towards peers, parents, teachers, and other authority figures including law enforcement officials. And the next one is obsessive compulsive disorder or OCD. And the last one is obsessive compulsive disorder or OCD. OCD is sometimes considered an anxiety disorder characterized by recurrent unwanted thoughts and compulsive repeated behaviors. Repeated behaviors such as counting, cleaning are often performed.
What is traumatic brain injury? A traumatic brain injury, or also known as TBI, refers to a brain injury that is caused by an outside force. TBI can be caused by a forceful bump, blow, or jolt to the head or body, or from an object entering the brain. Not all blows or jolts to the head result in TBI. Some types of TBI can cause temporary or short-term problems with brain function, including problems with how a person thinks, understand, moves, communicate, and also acts. More serious TBI can lead to severe and permanent disability and even death. There are two broad types of head injury, penetrating and non-penetrating. Penetrating TBI, or also known as open TBI, happen when an object pierces the skull, like example bullet, shrapnel, bone fragment, etc., and enters the brain tissue. So penetrating TBI typically damages only part of the brain. Non-penetrating TBI, also known as closed head injury or blunt TBI, is caused by external force strong enough to move the brain within the skull. Causes include falls, motor vehicle crashes, sport injuries, blast injuries, or being struck by an object. How does TBI affect the brain? TBI-related damage can be confined to one area of the brain, known as a focal injury, or it can occur over a more widespread area, known as diffuse injury. The type of injury also affects how the brain is damaged. The type of damage usually seen in the brain from the TBL include bleeding, swelling, and tearing that injures nerve fibers. This damage can cause inflammation, swelling, and metabolic changes. Diffuse axonal injury, or DAI. One of the most common types of brain injuries refers to widespread damage to the brain white matter. DAI commonly occurs in auto accident, falls, or sports injury. It can disrupt and break down communication among nerve cells in the brain. It also leads to release the brain chemicals that can cause further damage. Brain damage may be temporary or permanent, and recovery can take a long time. Concussion is a type of mild TBI that may be considered a temporary injury to the brain, but can take minutes to several months to heal. Concussion may be caused by a blow to the head, a sports injury or fall, a motor vehicle accident, or a rapid movement of the brain within the skull, as can happen when a person is vitally shaken. Hematomas are bleeding in and around the brain caused by a burst blood vessels. These are the four types of hematomas. First is epidural hematomas. Involve bleeding into the area between the skull and the dura mater. This can occur within minutes to hours after injury and are particularly dangerous. Second is subdural hematomas. Involve bleeding between the dura and arachnoid mater. Unlike epidural hematomas, exert pressure on the outside of the brain. They are very common in older adults after a fall. Third is subarachnoid hemorrhage. Is bleeding between the arachnoid mater and the pia mater. Fourth is intracerebral hematura. Involves bleeding into the brain itself and damages the surrounding tissue. Contusion are a bruising or swelling of the brain that occurs when very small blood vessels bleed into brain tissue. Contusion can occur directly under the impact site, or more often on the complete opposite side of the brain from the impact. They can appear after a delay of hours to a day. This generally occurs when the head abruptly decelerates, which causes the brain to bounce back and forth within the skull. Skull fractures are break or cracks in one or more of the bones that form the skull. They are the result of blunt force trauma and can cause damage to the membranes, blood vessels, and brain under the fracture. Helmets can help prevent skull fractures. Chronic traumatic encephalopathy, or CTI, is a progressive neurological disorder with symptoms that may include problems with thinking, understanding, and communicating, movement disorder, problems with impulse control and depression, confusion, and irritability. While it was originally identified only at autopsy, research today suggests CTI may be caused in part of repeated TBI. It develops over years and can take years to show symptoms. Studies of retired boxers can show that repeated blows to the head can cause issues including memory problems, tremors, or lack of coordination, and dementia. Post-traumatic dementia, or PTD, can arise after a single severe TBI. PTD may be progressive and share some feature with CTI. Studies assessing patterns among large population of people with TBI indicate that moderate or severe TBI in early or midlife may be associated with increased risk of dementia later in life. These are the examples of secondary damage include hemorrhagic progression of a contusion, or HPC, or injuries that occur when a contusion continues to bleed in and around the brain and expand over time. These create a new or larger lesion and leads to swelling and further brain cell loss. Second is a breakdown in the blood-brain barrier. Refers to the disruption of the network that controls the movement of cells and molecules between the blood and fluid that surrounds the brain nerve cells. Once the blood-brain barrier is disrupted, blood, plasma proteins, and other foreign substances leak into the space between neurons in the brain and triggers the chain reaction that causes brain swelling. It also causes inflammatory response, which can be harmful to the body if they continue for an extended period of time, and the inappropriate release of neurotransmitters, which can damage or kill nerve cells. Third is increased intracranial pressure. It is usually caused by brain swelling inside the skull as a result of the injury. This pressure can damage brain tissue and prevent blood flow to the brain, depriving it of the oxygen it needs to function. Who is more likely to get a traumatic brain injury? Adults aged 65 and older are at a greatest risk for being hospitalized and dying from a TBI, most often from a fall. In every age group. Serious TBI rates are higher for men than for women. Men are more likely to be hospitalized and are nearly 3 times more likely to die from a TBI than women. These are the leading causes of TBI include falls. According to the Centers for Disease Control and Prevention (CDC), falls are the most common cause of TBI and occur most frequently among the youngest and oldest age group. Second is the blunt trauma accidents. Accidents that involve being struck by or against an object, particularly sports-related injuries, are the major cause of TBI. Third is vehicle-related injuries. Pedestrian-involved accidents, as well as accidents involving motor vehicles and bicycles, are the third most common cause of TBI. Fourth is assault violence. Abuse-related TBI are head injuries that result from intimate partner violence, assault chicken baby syndrome, and wounds to the head caused by gunshot or other weapon. Fifth is explosion, blast. TBI caused by blast trauma from roadside bombs have become a common injuries to service members in military conflict. The majority of these TBI are classified as mild head injuries. How is a traumatic brain injury diagnosed and treated? Preventing TBI. The best treatment for TBI is prevention. Unlike most neurological disorders, head injuries can be prevented. The following action can help prevent TBI. First is wear a seatbelt. And second is wear a helmet when riding a bicycle, skateboarding, and playing sports like hockey and football. Make sure it is the appropriate helmet for the activity and that is fits correctly. Third is never drive under the influence of drugs and alcohol. And fourth is improve balance and strength with a regular physical activity program. And fifth is make changes in the home to prevent falls like install window guards and safe gates for young children. Next is improve lighting and remove rugs, clutter, and other trip hazard in hallways. And next is use non-slip mats and install grab bars next to the toilets and in tubs or shower, especially for older adults. And next is install handrails on stairways. Diagnosing TBI. All TBI should be evaluated immediately. A professional who has experience with head injuries. A neurological exam will judge motor and sensory skills and test hearing and speech, coordination and balance, mental status, and changes in moods or behavior, among other abilities. Treating TBI. Many factors, including the size, severity, and location of the brain injury, influence how TBI is treated and how quickly a person might recover. Although brain injury often occurs at the moment of head impact, much of the damage related to severe TBI develops from secondary injuries, which happen days or weeks after the initial trauma. For this reason, people who receive immediate medical attention at the certified trauma centers tend to have a best health outcomes. Mild TBI. Some people with mild TBI, such as concussion, may not require treatment other than rest and over-the-counter pain relievers. Treatment should focus on symptoms relief and brain rest. Brain rest means avoiding activities that require concentration or attention. The person should be monitored by their healthcare providers to note new or worsening symptoms. Severe TBI. Immediate treatment for someone who has a severe TBI focuses on preventing death, stabilizing the person's spinal cord, heart, lung, and other vital organ function, ensuring proper oxygen delivery and breathing, and controlling blood pressure and preventing further brain damage. Emergency staff care staff will monitor the flow of blood to the brain, brain temperature, pressure inside the skull, and the brain oxygen supply. A person with severe TBI may need surgery to relieve pressure inside the skull, remove debris, dead brain tissue, or hematomas, or repair skull fractures. While in the hospital for severe TBI, the person should be monitored for infection, particularly pneumonia, and deep vein thrombosis, blood clot that can form during a long period of inactivity. Rehabilitation for severe TBI. Once their injuries are treated and stabilized in the hospital, people with severe TBI are often transferred to a rehabilitation center where a multidisciplinary team of healthcare providers help with recovery. The rehabilitation team include neurologists, nurses, psychologists, and nutritionists, as well as physical, occupational, vocational, speech, and respiratory therapists. Therapy is aimed at improving the person's ability to perform activities of daily living and to address cognitive, physical, occupational, and emotional difficulties. Treatment may be needed on a short or long-term basis.
Good day.
Before I am going to tackle about multiple disability, let me define first what is disability. According to American Disabilities Act or ADA, disability is any condition that severely limits someone's abilities. There are different types of disability. These are physical, emotional, and lastly is mental disability. Other people born with disability and okay. Other people born with disability and other people may develop as the time goes by. Congenit, congenital disability. Congenital disability is when a person born with disability. Good day. Before I am going to tackle about multiple disability, let me define first what is disability. According to American Disabilities Act or ADA, disability is any condition that severely limits someone's abilities. There are different types of disability. These are physical, emotional, and lastly is mental disability. Other people born with disability and okay. Other people born with disability and other people may develop as the time goes by. Congenit, congenital disability. Congenital disability is when a person born with disability. And now let's proceed to multiple disabilities. According to Individuals with Disabilities Education Act, multiple disabilities is when a person has one or more disabilities. In order for a person to be labeled as having multiple disabilities, it must have intellectual disabilities. In order for a person to be labeled as having multiple disabilities, it must have intellectual disabilities. These are orthopedic impairment, sensory impairment, and lastly, behavioral or emotional issues. There are examples of multiple disabilities. It includes I know, cerebral palsy and epilepsy, autism spectrum disorder, and ADHD. There are examples of multiple disabilities, just like cerebral palsy and epilepsy. Orthopedic impairments are impairments in physical functionality of bones, joints, and muscles of a child that are severe enough that can have negative effects on child educational process. Next is emotional and behavioral issues. It is a specific mental health disorder that cause extremely difficulties, both emotions
and behaviors. Also, it affects a person's ability to be happy and control their emotions and pay attention in school. Next is we have sensory impairment. This is a condition in which one or more of our body's sensory functions such as visual, hearing, smell, touch, and taste are not functioning or impaired. Next is we have muscular dystrophy and learning disability. This is a combination of muscular dystrophy which affects the muscle strength and function, and learning disability which affects cognitive abilities related to reading, writing, and arithmetic. Fourth is we have cerebral palsy and hearing impairment. It is a combination of cerebral palsy, which affects muscle tone and movement, and hearing impairment, which affects ability to hear. Second is the environmental factors. Prenatal exposure to environmental toxins, such as infections, that can increase multiple disabilities. Third is birth injuries. Trauma during birth, such as oxygen deprivation or physical injury. For example, the cerebral palsy. It is caused by brain damage that can be a result of a brain injury. Fourth is we have traumatic brain injury, which can be caused by accidents, falls, or violence that result of having multiple disabilities, such as cognitive impairments, mobility impairments, and behavioral problems. And lastly is we have premature birth. Babies born prematurely are at risk of multiple disabilities due to the immature development of their organs and systems.
Visual impairment. This is a broad term encompassing any loss of vision that cannot be corrected, including blindness. That specifically refers to severe visual impairment where vision cannot be improved and corrective lenses. And generalized visual impairment refers to any loss of vision that cannot be corrected with glasses, contact lenses, medication, or surgery, and it encompasses the spectrum of visual loss, ranging from mild to severe, and can significantly impact of a person's ability to perform daily tasks, interact with the environment, and participate in social activities. One of the most common misconceptions about blind children is they are equally or more adept in language skills than their normally sighted peers. That's according to Freiberg 1977. In reality, severe and early impairments are likely to affect the language development of affected children. This study by Konachi and Mori 1993 found that almost paradoxically parents of blind children were less likely to accompany emphasize the meanings of their communication to the child or to describe objects and even in details.
Next is ang diabetic retinopathy, damage to the blood vessels in the retina causing blurry vision, distorted vision, or blind spots. The next is ang age-related macular degeneration or ang AMD, damage to the macula, the central part of the retina, causing central vision loss. The next is ang retinitis. Retinitis pigmentosa, a group of inherited eye diseases that cause progressive vision loss, often starting with the night blindness. And the last one is ang cortical visual impairment or ang CVI, a neurological condition that affects the brain's ability to process visual information, causing a wide range of visual difficulties. The cause of visual impairment can be used by a variety of factors. Eye diseases, cataract, glaucoma, diabetic retinopathy, AMD, and retinitis pigmentosa are some of the most common eye diseases that can lead to a vision loss. Impact of the visual impairment. So visual impairment can significantly impact an individual's life, affecting their ability to perform daily tasks, interact with the environment, recognize faces, or it's either participate in social activities. So for treatment and management of visual impairment, treatment for visual impairment depends on the underlying causes. Some conditions such as cataract can be surgically corrected. Others, such as glaucoma, require ongoing management with medication or laser treatment. For individuals with low vision, there are a variety
to accessible devices and rehabilitation programs that can help them to adapt to their vision loss and maintain independence. That may include the magnifiers, the low vision aids, braille, guide dogs, or vision rehabilitation services. So
Hi everyone, good day. Today, let's dive into the world of deaf blindness. Imagine a world where you can fully see or hear. That's the reality for children who are deaf blindness. This unique disability is a combination of hearing and vision loss, creating complex and challenging experiences. Did you know that deaf blindness is also known as dual sensory impairment and multisensory impairment? And there are two types of deaf blindness. The first one is the congenital deaf blindness, and the second one is the acquired deaf blindness. When we say congenital deaf blindness, it is a term used when a person was born with sight and hearing loss. This may be due to the infection during pregnancy or the premature birth. On the other hand, the acquired deaf blindness is a term used when a person experiences sight and hearing loss later in life. Any one of us can experience or can become a deaf blind through illness, accident, or as a result of aging. Deaf blindness can be caused by a variety of factors, including complications from prematurity, genetic syndromes like Usher syndrome or a Charge syndrome, prenatal complications like CMV or hydrocephaly, postnatal issues like meningitis or head injury, and sometimes the cause is unknown. While some individuals are profoundly deaf and completely blind, most have some usable vision or hearing. Deaf blindness affects each person differently based on the cause, level of loss, and other disabilities they may have. Children who are deaf blind have unique ways of communicating and learning. They may rely heavily on touch, sign language, or other adapted communication methods. They learn best in environments that cater to their sensory needs, and they often require more time to develop communication and learning skills. Supporting a child with deaf blindness requires a team effort. Teachers of the deaf blind, interveners, general and special education teachers, therapists, and families all play vital roles. Early intervention is crucial for helping these children reach their full potential. While deaf blindness presents challenges, it's important to remember that each child is unique. With the right support, they can thrive and lead fulfilling lives.
So good day everyone. So now let's talk about the other health impairment. So what is the other health impairment? This is a broad category encompassing chronic or acute health problems that significantly impact a student's educational performance. Unlike specific disabilities like autism or cerebral palsy, OHI covers a wide range of conditions, making diagnosis and support planning complex. This report will be explore the key aspect of OHI, including its definition, common conditions, impact on education, and effective intervention strategies. So, the Individual with Disabilities Education Act IDEA defines OHI as limited strength, vitality, or alertness, including the heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, and sickle cell anemia. And Tourette syndrome, this definition highlights the impact on a student's ability to learn rather than focusing solely on the medical diagnosis. The key is that the health condition must demonstrably affect the student's educational performance. So, what is the common conditions? The range of conditions classified under the other health impairments is extensive. Some of the most frequently encountered included the attention deficit, asthma, diabetes, epilepsy, chronic illness, Tourette syndrome, anxiety disorders, depression. The impact of education of OHI in the education of the student's education can vary widely depending on the specific condition and severity. However, common challenges like reduces academic performance, social and emotional difficulties, behavioral challenges, hyperactivity, increased healthcare needs student with OHI, increased healthcare needs. So the effective intervention is support for students with OHI requires a multifaceted approach involving collaboration between educators, healthcare professionals, parents, and the students themselves. Case strategies including the individualized education or the program IEP, classroom accommodations, behavioral interventions, collaboration with the healthcare provider, mental health support, and the last is the parent and family involvement. So OHI or other health impairments represent a diverse range of health conditions impacting students' educational experiences. Understanding the specific challenges posed by each condition and implementing individualized support strategies are crucial for ensuring that students with OHI have equal access to quality education and can reach their full potential.